much consideration have you given to the cost of providing health care in your country? Hi, it's Nancy Beauvert here with Agape and NEXsteps, and today I wanted to tackle the often controversial issue of healthcare spending. So I happen to live in Canada, which, as many people know, we have a government-funded, government-supported type of healthcare system. So we pay our tax dollars, which go into our federal system, and then are allocated to each of the provinces who, under our Constitution, have jurisdiction over healthcare funding. That's in contrast to the United States of America, that has a system where you pay as you go. So I was really interested in the last few weeks. I came across an article, actually a chart, that was produced by the Visual Capitalist. And it took an analysis of the top 12 developed countries. Now, I know that we tend to think that the more money that you spend on something, the better the coverage is. And this graph actually showed the opposite of that. The United States actually spends over $12,000 per capita for each of their citizens, which is at the top of the list. And yet, out of these 12 countries, they have actually the lowest life expectancy. On average, 5 years younger than these other 12 countries. Canada, if I recall, came in around the middle of the pack. We spend roughly half of what the US spends, but our life expectancy, instead of 77 years, is around 82 years of age. So that started me thinking about where we are with our medical system. Now, our medical system is truly one of the most politically sensitive items, and also a very personal issue for people to talk about. Because without our health, we really have nothing. But we have to stop and consider about the cost value. Now let me reflect to some Americans that I've spoken to. We've all heard about these outrageous bills. Somebody in the States has cancer, or they're in a vehicle accident, or they have a heart attack or something, and they end up with a bill from the hospital in the hundreds of thousands of dollars. And the reality is, most people can't afford to pay those kinds of bills. So I asked a few Americans about what happens in that case, and they said, all of these people had said that really the expectation isn't that they're going to get the $800,000. What happens is the families have to go in, they negotiate, and they pay what they can. Now, granted, some people in the States have health coverage. Some of their medical plans will cover for certain things. Although my understanding as well is typical of most insurance companies, you pay your insurance premiums, but then they don't necessarily want to pay out on them. So there's always that negligible part about, is your insurance actually going to cover this, said requirements? Now, our Canadian system is far from perfect. We can wait months, if not years, to see specialists, to have certain tests done. And without question, those time delays can become life-threatening. Although in most cases they are kind of triaged, and if you have an emergent need, they will try to get you to the top of the list. But that still doesn't alter the fact that you can't walk in today and get a diagnosis and walk in a week and have a test. You can if you're willing to pay privately for it, which creates a whole nother level of discussion for another topic, which is the argument that a lot of people in the medical profession have about if we should have accessibility for some of these private pay. Now, I personally think that there's nothing wrong with that. I know people who have opted into the private clinics. They're kind of a private-public blend here in Canada. So what happens is you pay an annual fee. Typically, to get into it, it's like $5,500 for the year, and then on a renewal, it's in the neighborhood of $4,500 a year. The difference in our system here is that anything that is covered by our health care is not an extra fee for any of those clinics. But what those clinics provide is access to a whole wellness team. You can have chiropractors, you can have physiotherapists, you have 24/7 access to a doctor, maybe not your doctor, but you have 24/7 access to a doctor. Honestly, that is not a large investment per year to make sure that you have all aspects of your healthcare covered. That also includes nutritionists, dietitians. And that brings me to another point. Part of the issue with our medical systems globally is that our medical systems are focused on illness. They're not focused on wellness. Now, that is not the fault of the medical profession. That is the way the doctors are trained. Our medical schools teach people to diagnose and identify illnesses and how to treat those illnesses. Let's face it, back in the early days, when they were discovering about how the body functions, doctors or physicians or people that were in that kind of realm were the original grave diggers. The way that they learned about the human bodies was to exhume bodies from graves and essentially do their own dissection of them to learn about them. So the focus is on illness and treating illnesses. There's never a focus on wellness. I remember back in 1995, I was part of a group that was involved in the National Forum on Health. And by and large, it was people in the medical community. It was supposed to be a cross-section of everybody, including healthcare providers and the average citizen on the street, but it was heavily weighed to people in the healthcare industry. And I'll never forget it. I remember talking in 1995, 1996, I remember saying, we need to teach people how to be well instead of how to get better. And one of the doctors in my group, my breakout group, actually said that was the role of the government. Now, I don't know where he came up with that. That certainly, in my estimation, isn't the role of our government. But he said that it's up to the government to educate about wellness, and doctors were just supposed to treat illness. Until we can shift that mindset and we get more of an emphasis on how to eat well, how to be nutritionally sound, what kind of lifestyle we should be supporting, how to incorporate exercise into our lives, until we start focusing on how to be well, we're going to continue to have these escalating costs and these escalating illnesses and these escalating problems in our healthcare system. So I don't know if you agree with me or not. If you do, great. If you don't, great. Please just send me your comments, and I look forward to talking to you again. Thanks. Bye for now.